thing here, this handout, in here, and it talks about the handling techniques in PNF, okay? The principles of proprioceptive neuromuscular facilitation are that PNF is about, if I give people proprioception and sensory awareness of where their joints are in space, the muscles will then follow. They'll kick in. Okay? So all of the things we do in PNF are weight bearing, place and hold, traction, anything to give the joint input, okay, is what we do in PNF. Now, in PNF, the other important concept in PNF are the diagonal movements. And you have, I swear that somebody told me that they asked about something about proprioceptive neuromuscular facilitation on the exam, which I was kind of surprised at.
You look at 699.
699?
Well, PNF is around in this, yeah.
Thanks,
Chapter 26, somewhere in,
Yeah.
I don't know if that's right. 699, 78, somewhere.
Yeah.
Yeah.
So, I want you to know about these D's, the motor patterns, okay? So you kind of have to memorize these diagonals, okay? Now, the diagonals are about really the combinations of movements, okay? And there's D1, D2, there's 4 diagonal patterns, okay? And if you look on page 698, the upper extremity patterns are there, okay? And the first one, deflection, is flexion and external rotation, okay? The same D1 extension, okay, goes this way. So D1 is here to here, okay? So think of it as the ta-da, okay, D1 is ta-da, okay? D2, okay, is flexion and abduction, okay? And then, so it goes here to here. This is the Saturday Night Fever one. And the night fever, we know how to do it, okay? But there's lots of activities. Now, we may not go in the full range of motion, and a lot of times we'll rotate our trunk with it. So putting something in the closet, those kinds of things, okay? So there's this one to here, okay? There's this one to here, okay? The legs have the same patterns, okay? So we did this one, okay? There's also here to here, okay? Here to here. I call that the lawnmower. Yeah. Okay, so like when you're pulling a lawnmower to start it.
No, that's not D2.
It might be another pattern. I don't care that you know D1, D2. Just know what the movement patterns are. So you have this to here, okay? Then you have a cross body to abduction. And then you have here to here, too. So I call this one the putting on your earring diagonal, or taking it off, and then you put it on the table. Put it on, take it off. So think about all of the activities that we do on a daily basis that incorporate these movements. The key thing with facilitating this movement is it always starts with rotation. So in order to get this movement out of my patient, I always want to start the pattern with rotation, okay? Okay?
All the patterns.
Yeah. Mm-hmm. So I'll do this with the patient, and let me get a chair here. So Alan, you be my patient over here. sit right here. Can you see him, Jenny?
Yes.
Okay. So Alan has had a stroke on this side, okay? And he's kind of floppy, okay? And I'm going to do, you know, I'm really giving him quite a bit of input here to let him know where his joint is in space. Alan, did you know that most movements don't occur like this? So what we're going to try to do, I'm going to try to help you. Can you sit up a little straighter for me? Thank you. What we're going to try to do is kind of go like this, where you're pushing against my hand, and then you're pulling. Ready? Push, Alan. Push, 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 push. Come on, push. Okay, now pull up towards your ear. Pull up towards your ear. Push, man. Come on, push, push. Push, no, towards your knee, towards your knee. Oh, okay. And now back, back. You see how I rotated? Now push toward that way. Ready? Push, push. Okay, now pull. I am resisting, and here's where I don't have much strength. Push, pull. Come on, come on, come on. Pull, pull, pull. Push, 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 push. Okay?
And you facilitate rotation with this elbow.
Yes, and so I'm kind of like giving you input here, but giving you resistance to movement. And it's about this rotary kind of movement, rotary diagonal movements. More effective than straight plane exercising, okay? You could also do rotary movement like this in, did you mind getting on the floor and quadruped?
Yeah, I do that.
So the same movement, okay, good, right there is good. Okay, now Alan, what I'm trying to get is rotation here, and this is his good side. This is his hemiplegic side. Alan, I want you to reach over for that wheel and back. Reach over for the wheel. So I'm getting the rotary and the diagonal movement in a more passive way over this extremity in weight bearing.
You're really using your knee for that, right?
I am, to stabilize your body. Okay, so I'd be up on the mat with him doing this. Okay, does that make sense?
Still dancing.
Yeah.
Yeah, because I didn't know how she did it either. So.
Okay, so I got him here. Okay, I'm kind of using my knee to help his trunk so he doesn't
So you
collapse.
stabilize his trunk.
But what I'm trying to go for is this rotation of his humerus, okay, and the weight bearing over here, because this is his weak arm. And I could do this in bent elbow, you know, but he's pretty high functioning. So Alan, I want you to take this arm and reach for that wheel, okay, and he goes diagonal here, and then as he goes over here, he goes to different
She's actually
diagonal.
doing this. So.
Okay? I'm more using here, yeah, I am, to stabilize it, because if he doesn't have good tone. Now I might need to have both hands there, or a tech over here, if he's can't stabilize it. Does that make sense? Okay? It is. When I treat stroke patients, especially more able-bodied stroke patients, like young guys with brain injury, you're like on the mat sweating your butt off. Yeah. So, yeah, this does not work for the faint of heart at all. But you really see results when you do handling techniques. You can go back. Thank you.
So like where would you use this, like in a hospital, inpatient?
In a mat, yeah, outpatient clinic, that kind of
Do
thing.
they have like a code for like the PNF for the neuromuscular, or like?
I think the treatment code is called Neuromuscular Re-Education, and all of these techniques are included in that. So you don't really have to document fully what you did. You know, you might say, patient seen for neuro-re-ed for 20 minutes. We did some PNF, we did facilitation from the pelvis, which worked really well, or something, so you know what to do the next treatment session. Okay?
Can you
yes.
repeat the lawnmower and the night fever and all that?
Okay, do not worry about memorizing D1, D2. I don't really care about that. Okay, so we have this to here as a diagonal pattern. Okay?
Extension?
That's adduction.
Okay, you're in external
Adduction.
rotation, adduction, to internal rotation, abduction. That's one diagonal.
Is that like the Saturday Night Fever?
Is that the way that one
Yeah.
goes?
No.
But you turned it over.
That's this.
That's that one.
This is this one. We know how to do it. Okay?
I know everybody doing the feet because I got all the
Cross that line.
Here's the
Okay.
YouTube video.
Oh, in fact, did you see the video that I put up?
Yes.
It was the PNF diagonals. Wasn't it Miley Cyrus?
The Miley
or-
Cyrus
Yeah.
country.
That was OT students doing it. But, okay?
You could tell.
All right. So we got
Disco
here
would have been
to
better.
here, right? I say do something and put it in your pocket. Save it for a rainy day, okay? Pick a falling star and put it in your pocket. Save it for a rainy day. When the night fever, right? Lawnmower. Okay? Earring.
Can we put the motions with it, like you're starting with internal rotation and
What I would really like, oh, okay, yeah. So look, internal rotation, adduction, flexion. Okay, for the earring. Then when I put the earring on the table, okay, actually I go into a little external and then I go a little more internal. Okay, extension and abduction. Okay, it's just the opposite of all the movements. Okay? External rotation, extension to internal rotation, abduction. Okay? So you guys figure it out. What you may want to think about is what activities go along with these things, right? So think about emptying a dishwasher and putting it on the shelf above your head. It kind of almost incorporates several of these diagonals, you know? Doing laundry, right? Brushing your hair. Look at that. Putting it down, brushing your teeth kind of incorporates the diagonal. Putting your earring on. This is sort of the first diagonal we talked about. This piece of it. Huh? Yeah. Yeah. Right. Washing your back. Yeah. So, what you confused about?
Yeah, putting on a jacket.
Thank you. That's
You
dangerous.
stretch your arm, put on.
Okay. So that's kind of all I want you to know about PNF is facilitating these diagonals by this place, hold, and these resistive sort of hand-over-hand exercises. So you could do that with PNF, or you could do PNF by making them sort of just circle around the mat in weight bearing. Again, with old folks, we're probably not going to be getting them on the mat, but a young 18-year-old kid with brain injury, you know, if they're halfway mobile but have high tone, you might be able to do that. Okay, the last thing I want to go over under neuro stuff, and then we'll take a break, is look on page, this little handout that I gave you, and this handout is really good. And you may have talked about this with Susan. Okay. Table 6.3, page 70, and it goes page 71 and page 72. Now, Margaret Rood was a PT, and she talked about, sort of like she was a little bit after the Bobaths. And she said, in addition to what the Bobaths are talking about, there's other little handling techniques you could do. And so she's the one who talked about tapping and shaking as being facilitatory, okay? So let's kind of make a list, okay, of what handling techniques are facilitatory and what is inhibitory, okay? In general, fast movements are facilitatory and slow movements are inhibitory, right?
Yeah.
Deep pressure is inhibitory, light touch is facilitatory. So what I'll do to a little kid, okay, I don't want to do it to you, you'll think I'm weird, okay? So be your head forward position here, and you're kind of like all bent over, and I'll have a little kid, and I'll go, head up, and I'll just blow on their neck. Head up, come on. And do a little feather, tickle them, okay? Whereas if a kid's like this, rub your shoulders up and you're all like tight, okay? I might do slow, deep pressure. I might do a weighted vest. I might do, you know, heavy, deep pressure is calming, okay?
What about if there's this and you do the thumb up the back deal? And they
What
go-
does that do?
It brings them.
Light touch.
Well, you just stroke up the spine and
That's
then they
light
get that.
touch, right? And that brings them upward.
Yeah, he goes.
Yes.
Woo,
Yeah.
'cause he does
That's
this.
facilitatory, okay? All right? Getting a kid, okay, so we have our kid with Down syndrome, okay? We want to use a ball, right? They're floppy, low tone. Get them bouncing on the ball, okay? Now you have your kid with, or your adult with high tone. You can put them over a ball, but it better be slow rocking on top of the ball. The minute you bounce them, you've just made their tone 10 times worse, okay? Margaret Root also talked about icing, okay? Just like I was doing, you know, this slow, you can have a cup of ice, you know, like in a little Dixie cup, the little bathroom cups. Peel off the top where you can hold the thing and just do quick stroking of ice, and that is facilitatory, okay? I prefer tapping or the vibrator because the ice is messy, okay? Now, if you want to use inhibitory icing, use an ice pack and leave it on for 20 minutes, okay? Nobody likes ice stuff. You've got to have it on a long time before it has an effect. So people with high tone do not enjoy ice. A good technique, if somebody does have high tone or high muscle activity, is something called neutral warmth, where you wrap the whole limb in a blanket in air splint, and that provides warmth on both sides of the joint and tends to have a relaxing effect.
So that's an
Inhibitory, okay?
why?
I'm talking warm, like not heated. It's not, it's like a room temperature blanket and you wrap around it. It creates, you know, like the same temperature on the flexors as the extensors.
Is that like if somebody maybe puts it on like over an arm and maybe have it in weight bearing?
Yes.
Is that something?
Exactly.
Well, before you said inhibitory, I said facilitatory in my head, so maybe I'm not
It's inhibitory. It's calming.
calming what? The reflex?
It's
Air reflex?
calming really the cutaneous receptors and thus the muscles that are under the skin, right? Think about yourself, all right? If you're upset and you kind of wrap yourself in a sweater, and that sweater's kind of tight too, it provides some nice deep compression. So what I used to do to Robert every night, because he was kind of a sensory kid, every night after we took a bath, we played a game called rock and roll. And I would lay him in his towel and like really kind of hold the towel so he was maybe just up above the bed, a quarter of an inch, and we say, rock and roll, let's do it 10 times, rock and roll, let's make a Robert sandwich. And then I would like kind of wrap the towel around him and do deep pressure, and this would kind of calm him before he went to bed. You know, now he's no problem going to sleep, thank God. You know? Do you see?
Yeah, that makes sense.
Okay. Okay. Traction. So if I do pulling on your arm, it tends to be facilitatory. So when I do this, it makes you want to go into flexion. So if somebody has flexor spasticity, you shouldn't try to yank them out into traction. You should do deep compression on the muscle belly near the insertion, and that will have an inhibitory effect. If you're hot, low tone, traction's just great with some shaking, and it get you alert.
So compression is inhibitory?
Slow compression is inhibitory. Quick compression, where you place and hold, that is facilitatory. It's like, Keith, you probably know, what kind of karate did you used to do? Or do you- Oh, okay. So, yeah, that. So we have like this one movement, like where we go, I can't even do it, where we go. And you like really, and you really fling out. But because of the slap, because I'm dangerous today. Because of the slapping of the foot, it tends to be facilitatory, so it means you're ready to fight. Does that make sense?
Yes.
All right? Yeah, it's actually like where you go, like, and you fling, and then you go like this. And I'll show it to you. Yeah.
Is it like a sumo?
No, but it's the act of that place and hold on your feet really makes you vigorously do a back fist. It's a wild movement. It's but it's kind of fun to do because it's like
So think
strong.
relaxing and crossing midline like Tai Chi, where you're doing
Right. It's
smooth
smooth,
and
control
slow.
movement, rotary movements, right? Okay, absolutely.
That would be the opposite.
Neutral warm. Oh, the other thing, the last thing on page 72. Okay, slow stroking along the dorsal rami. Okay, so you talked about quick stroking. Slow stroking along the dorsal rami on either side of the spine tends to be calming. Okay, so you get a kid, brain injury, agitated as hell, put them on the mat, just do that for a few minutes, talk to the kid, okay? Wow, you're having a rough day, aren't you? Slow stroking. Then you might be able to get some work done. But you've got to calm the nervous system first, okay? 2, we talked about neutral warm, slow vestibular stimulation. So I am just a ball of tone. Rock and roll, let's make a kid sandwich, let's make an adult sandwich, whatever. We called it hot dog, okay? Fast vestibular stimulation is the bouncing or rolling people fast or spinning them. That's going to facilitate muscle tone, okay? All right, now there is a... the synergies are described here as well. Upper extremity synergy, lower extremity, page 73. And there are some good review questions in the back here, okay? Really on page 79 through 82. Okay. You kind of did the stuff on page 84, the little exercises. Get up from a chair to standing, standing up from supine on the floor. Some of you tried that. So I think this chapter almost kind of like gives you the cliff notes of the 4 or 5 chapters in your book. Not that I'm telling you not to read the book, but this, I think, is more useful almost because the book is a little overwhelming, right? Yeah. Okay, any questions on neuromotor stuff? All right, let's take in